Western Cape Health MEC, Dr. Nomafrench Mbombo, will visit the Cape Medical Depot today. Mbombo will be assessing its state of readiness to store and distribute vaccines. And our reporter, Newzroom Afrika's Athi Mtongana, joins us now live ahead of that visit. Athi, the last time you and I spoke, you were standing at BioVac in Pinelands in Cape Town as we were building up to exactly where the vaccines would be stored. Tell us more about how the Cape Medical Depot fits into that puzzle.
Well, let's begin here, Michelle. You may know that following the arrival of the vaccines this week, they were taken to a warehouse in Johannesburg. And following that, we know that samples were taken to the National Control Laboratory, where SAHPRA, the South African Health Products Regulatory Authority, says that National Control Laboratory that has those samples of the AstraZeneca vaccine has been accredited by the World Health Organization. It is there where tests are currently being conducted to basically verify and assess quality assurance. And once they get the green light, Michelle, then provinces will, of course, receive their first batches of that AstraZeneca vaccine. We know that in the Western Cape Health Department is looking at least receiving those vaccines by at least the 15th of February. This is something that we, of course, knew before the vaccines arrived. The Minister of Health, Dr. Zweli Mkhize, making it very clear that when those vaccines arrive in the country, they have to go through a rigorous process wherein they would have to be tested to verify whether it is what the country bought. It is something that the country purchased and secured for ensuring that we curb the spread of COVID-19 in the country. So in the Western Cape, Michelle, we know that the Western Cape Health Department has secured at least 378 sites for vaccination. That's in the public sector. And in the private sector, they've identified about 41 sites for a distribution and, of course, their vaccination program in the private sector. So all in all, Michelle, the province is ready. It has been preparing to receive those vaccines, those much needed vaccines for the frontline healthcare workers. Now, another thing that we need to also remember in the Western Cape is that the Premier, Ellen Wendy, is currently trying to secure vaccines for this province. And of course, he's saying that it does not mean that the province will separate from that centralized procurement system. And it does not mean that they won't be sharing the vaccine if they do happen to get it. Remember, they would also have to receive all submissions. He's already getting a lot of applications from various vaccine manufacturers from across the world. You may know that globally the demand for vaccine is increasing, and a lot of companies, pharmaceutical companies, are right now trying to come up with a COVID-19 vaccine. So those applications from manufacturers coming in, and the Western Cape Premier Ellen Wendy saying he's receiving those applications, but of course those vaccine manufacturers have to be approved by the South African Health Products Regulatory Authority, which was actually briefing Parliament's Portfolio Committee on Health yesterday, telling them about their mandate and their role in ensuring that all clinical trials are tried and tested, and that any vaccine that comes into South Africa is one that would be clinically beneficial for human use. They've already been receiving a lot of applications as well from vaccine manufacturers, but something that the board chairperson, Professor Helen Riss, raised as a concern is the fact that the efficacy, Michelle, of some of these vaccines will have to be looked at in as far as the variant that was discovered in South Africa, the efficacy against this variant that was found in South Africa. So the more they submit these vaccines and the more that they go through the clinical trials through SAHPRA, they have to actually look at whether those vaccines will work against this variant that was found in South Africa. So the MEC for Health, Nomafrench Mbombo, like you rightfully put it, will today be visiting the Cape Depot to try and assess the readiness of it to receive those vaccines from the National Health Department.
Yeah, thanks very much for that update, Athi. As provinces now get ready for the vaccine rollout, now less than 2 weeks away, a beautiful morning there in Cape Town. Athi Mtongana, Live to us there from the city. The Western Cape saying 378 sites in the public sector getting ready for the vaccine rollout, 41 in the private sector. Around 2,000 vaccinators are being trained now via podcasts and videos.